Hello and welcome to microalignment therapy. Some of your views about chiropractic may be challenged by this presentation. If that's so, it's high time that you realize that some of the science that you were taught and accepted without question may be limiting your practice. I hope you're open to an expanded view about what I have to offer with microalignment therapy and how we can help more people with chiropractic. My name is Dr. Barbara James, and I've been very fortunate to be able to practice this technique for over 25 years. What I have found with my patients is they love this technique. They also love telling their family, their friends, and their coworkers about it. And they like sharing with their other healthcare providers what they like about this technique. It's a great practice builder. So let's take a look at how the adjustment is done. So I'd first like to demonstrate the adjustments as they're done on the thoracic spine, the ribs, the lumbar spine, and the sacroiliac joint. Once you've done your analysis, you're basically going to place your piezoform in the area where you want to do the adjustment, and when you're doing the movement, it's a small movement and you're doing a lever movement. There's no impulse and there's no quick movement. Same thing in the ribs. If there are ribs that need an adjustment, you can move your hand, your piezoform into place and simply do the lever movement. Lumbar spine is the same. Of course, it's deeper and you have to drop into the contact more and do your adjustment. And the same thing with the sacroiliac joints, although they are a much bigger joint and you do have to have a stronger movement for doing the adjustment. Now I'm going to demonstrate the position for an anterior cervical adjustment from the side. You're placing your hand to the anterior of the cervical TVP and doing the adjustment. And this can be done all down the anterior chain with a movement like that. And you can also do shots of the adjustments of the trochanter of the left hip. On the trochanter of the left hip, I'm doing an adjustment like that. You can do this posterior to anterior with the movement like that, and I would stand on the other side to do an anterior to posterior trochanter adjustment. So this adjustment can be for superior trochanter and strictly external rotation. So to do some of the cervical adjustments, I do them sitting and occiput as well. I'm just placing my hand on an inferior occiput and lifting it up, the movement like that. You can also do an adjustment on the atlas from the side. And the occiput can also be adjusted, lifted up on the left side. Leverage is a very important business concept because it means a strategic or tactical advantage. Microalignment therapy is a new paradigm of lever adjusting that definitely gives you an advantage by using your piezoform as a lever tool. The definition of paradigm is important to understand because we have a chiropractic adjusting paradigm. It is the adjusting model that forms the basis of chiropractic technique. Our current adjusting paradigm is high velocity, low amplitude, impulse-based thrust, commonly known as HVLA adjusting. It's important to understand how an adjusting paradigm defines us. It was well spoken by Dr. Guy Reekman that we do not live our paradigms, they live us. And it's very true that we may not understand how our current paradigm or belief does limit us. So where does lever adjusting fit? Well, there's no dynamics of velocity or speed, and there's no dynamics of amplitude. So it cannot truly be described as a force, not even a low force. And this means that lever adjusting does not have a place in our current paradigm. In the Core Symposium in 1996, I presented this poster, Expanding the Adjustment Paradigm. I propose that lever adjusting be added as a new Tier 5 specific contact. Why is this adjusting technique unknown to the chiropractic profession? Well, certainly lever adjusting is a different adjusting paradigm. It has not been organized or taught for over 20 years, and it's never been available or taught through chiropractic colleges. It's important to understand the power of our paradigms or beliefs. There are two ways to be fooled. One is to believe what isn't true. The other is to refuse to believe what is true. This information is from The Structure of Scientific Revolutions by Thomas Kuhn. When we understand an emerging paradigm, it's important to realize presenting a paradigm as truth or reality stifles investigation into the domain of the paradigm. And when the profession can no longer evade anomalies that subvert the existing tradition of scientific practice, then begin the extraordinary investigations. I believe lever adjusting has proven itself for over 40 years with acceptance from patients. If accepted by the chiropractic profession, it can potentially improve chiropractic market share. Market share is important to understand. Chiropractic market share is the percentage of the healthcare, back pain, wellness market accounted for by chiropractic. It's important because it's a sign of the profession's ability to provide services that the public considers valuable. This market research report from October 2013 shows the chiropractic in the U.S. has a revenue of $13 billion annually and an annual growth from 2008 to 2013 of 0.8%. In 2013, this revenue is expected to grow only 0.4% due to the residual effect of the recession. And the average gross income of chiropractors in the last 5 years, according to this study, is $83,691. We can increase chiropractic market share from a variety of sources, mainly innovation, broadening demographic appeal, lower prices, and advertising. It's important to understand that innovation does not come from peer-reviewed journals or institutions of higher learning. It emerges from clinicians in the field willing to improve their results with existing patients, broaden their demographic appeal, create a new market with a new skill set, and, in particular, expand their paradigm or comfort zone. When we want to expand our paradigms or beliefs, we need to understand what our existing paradigm is. Then we determine the limitations imposed by accepting the existing paradigm, and that could mean a limited market share. Then it's important to realize that our scientific beliefs can and do change. And finally, we need to evaluate the benefits of an expanded paradigm to our practice. I believe that HVLA adjusting is a chiropractic sacred cow. Sacred cow is a figurative speech, something that is regarded by some people with such respect and veneration that they do not like it being criticized by anyone in any way. Unfortunately, sacred cows are unquestioned rules, dogmatic systems, and ways of working that seem off limits to change. The problem is sacred cows block potential. If you blindly accept a pattern, or worse, feel forbidden to challenge it, then you can't improve it. You become stuck. Mark Twain has a great quote, "Sacred cows make great steak." There are a variety of reasons that prevent people from using chiropractic. Certainly previous poor results or experiences, other people's poor results, other people's negative strong opinions, which I call armchair chiropractors, and certainly the fear that the treatment will hurt or damage their body. The term armchair chiropractors I've coined from armchair scientists. Now, we know that medical doctors, other healthcare professionals, insurance companies, and oftentimes chiropractic patients are becoming armchair chiropractors. An armchair chiropractor is someone who has no professional training in chiropractic, yet has a strong opinion, based on personal experience or third-party opinions. Microalignment therapy has a great potential to bring more people for chiropractic care. Because of the focus on improved joint alignment, the fact that it's well received and expands the demographic appeal, and enrolls other healthcare professionals who refer patients who will not use traditional chiropractic services. We know that we can expand the chiropractic market share through innovation and broadening our demographic appeal. Because we know that only between 7 and 20% of the population currently use chiropractic, it's important to understand many more people know that they want good joint alignment, and they are choosing different healthcare providers to help them. Microalignment therapy is the breakthrough chiropractic technique that sets you apart from other doctors and creates extraordinary new outcomes for your patients. When you expand your adjusting skills, you will improve your chiropractic market share. I believe the key to expanding chiropractic is not through scientific study of the existing paradigm, and not through impulse adjusting tools or expensive computerized analysis. It's through increasing our market share and through doctors, chiropractors who deliver service valued by the public. This is a huge return on investment. For chiropractors who invest in their adjusting skills, they will improve their patient results, retention, and referrals for the rest of their career. My patients are always asking me, why aren't more chiropractors using this technique? This is what my patients said when I asked them, what would you say to doctors who are considering learning this technique? I believe people are attracted to experience microalignment therapy for 4 reasons. First of all, because of their previous good results, other people's good results, referrals from other professionals, and because they have increased confidence in their ability to heal with this technique. Microalignment appeals to discerning healthcare consumers due to the previous good results, the positive results of others, and the armchair chiropractors, some of who have never experienced a lever adjustment, will refer people who don't want impulse adjusting. Professional referrals are a high sign of respect for this service. Microalignment therapy appeals to discerning chiropractors because it expands the type of patients and conditions you can treat. It's easily applied to all joints of the body. And a very important point, it shifts the analytical focus from symptoms to whole body evaluation and treatment focus from pain relief to alignment correction. And it certainly expands patient and professional referrals. Microalignment therapy also appeals to results-oriented chiropractors because the results are measurable using all standard diagnostics. It does not require expensive tables, adjusting instruments, or computerized analysis. It integrates well with all your existing procedures and can be introduced to patients gradually. And it decreases physical adjusting stress. From sacred cows to emerging paradigms, from scientific revolution to increasing chiropractic market share. I've now given you a glimpse of the potential of microalignment therapy, what it has to offer you and the profession.